So like Roger said, I'm Maureen Mustard. And one of the projects that I work on is our New Hampshire HealthCost website. And so I'm just going to take a few minutes and tell you what we're working on with the website because it continues to evolve as we identify different areas of need. So just to give a little background for those of you who aren't familiar with our website, New Hampshire HealthCost is a tool that we created in the insurance department quite a number of years ago that's continued to evolve. It's a price transparency website. So we have nearly 200 cost estimates available on the site. Some are done in a bundled fashion, so it contains all of the different costs that a patient could reliably get charged on a given day for service for things like a colonoscopy or a radiation, like an X-ray or MRI. We also have unbundled costs. So those would be single costs that a patient might get, like a dental cleaning, where you would just have one cost that day. We have nearly 3,000 or over 3,000 providers listed on the site, whether they're dentists, radiologists, hospitals, outpatient service centers. We also have a statewide report that's included on the website. This is a bit of a different report. It's a downloadable Excel file that has over 4,000 rates available for users to get information on a number of different services available in the state. We also have quality indicators available on our website, so you can compare the quality of different hospitals in the state, and that's data that we pull in from national sources. It's not data that we produce in-house. We also have a guide to health insurance for consumers who have questions about health insurance, how to use their benefits, how to get health insurance, lots of different questions for consumers to become informed. So the past 7 months, we've done a lot of work trying to get the public aware of our website. We have had a lot more traffic on our website recently, thanks in part to some publicity about the website, but also an outreach campaign. We have a new outreach coordinator, Ariane, who's sitting in the front row. She and I have both gone to a number of different groups in the state, doing presentations, making people aware. What we've tried to do is go out and talk to people who then share the website with others. So we've gone to chambers of commerce, so small business owners, to tell them about it so they can share it with their employees. We've gone to health councils, people that work in the healthcare industry, to share with their patients. HR, professional groups at large companies can again share with the employees of the company, all just to create the awareness so people know this tool is available. We've sent articles to different organizations' newsletters, and then done some demonstrations at health clinics. So people that are working with patients who might be really price sensitive, they know how to work with them when they're in the office setting. So the HealthCost, like I said, is a tool that continues to evolve. The future of HealthCost right now, we're looking to, again, expand on the number of cost estimates available to consumers and add additional quality measures as they become publicly available from trusted sources. We continue to add questions and answers to our guide to health insurance. We have a way for consumers who are looking at our guide who have a question, who don't find the question they're asking, to send it to us, and we can add it to the guide. So it's an interactive tool. We also are looking to include Medicare and Medicaid prices for those people that might be looking for that information. Another area that we're looking at is providing information to employers as consumers of healthcare. We had a vendor do a report to provide recommendations. They interviewed a wide variety of employer types. They did surveys of brokers, asking questions about what would be most helpful when making healthcare decisions, when deciding which plans you're going to offer your employees, so that we could then provide some information on our website to help employers in their decision-making process. We want to empower these employers as consumers of health insurance, increasing their engagement in the New Hampshire health insurance marketplace. So how would we try to meet these needs? What employers were looking for was trended data on the marketplace. using additional data sources. Right now, all of our cost estimates are through our all payer claims database, and we will look at other data sources like the information that you saw in Jen's presentation today, taking that year-to-year information from our annual hearing and the supplemental data report and being able to show employers how things are changing year to year in a more interactive way, so they don't have to pull up the annual report every year and read through that to find out the information they're looking for, to present it in a way that's quick and easy for employers to access. Also, there'll be information about effective benefit design and cost-sharing options, and then a separate FAQ for employers. Employers, as purchasers of healthcare, have very different questions than the average consumer, and possibly even including a toolkit for employers to help educate their employees on how to utilize lower cost healthcare to drive down the cost of the overall premiums in health insurance. So we are always looking for feedback on our website. So as anyone is using the website, we hope that they would be able to provide us feedback if they have ideas, thoughts, questions. We want to serve the consumers of New Hampshire the best we can. So we have a comment section on our website for people to send general comments and questions. And in our guide, every question on the page has an option to give us a thumbs up that was a great answer to our question, and there's a thumbs down, which sometimes we got thumbs down and we thought, did they not like the answer, or was the answer not helpful? So we now provide a drop-down for people to select and give us more information, and an open comment box for people to give us more information so we can really improve the site. So as we go around sharing the information about HealthCost, we hope that those of you who are now aware of our website will go check it out and then tell your friends, tell your coworkers about it, so that more people will know that they can go out and find cost estimates for the cost of care and that they have different options. What we show on our website is just from the claims data. We're not biased. We just look at the rates. We calculate the median cost, what the consumer is most likely to pay. So it's an easy way for consumers to get a good idea of what it might cost to get a service done in the state, and that they have the right to go to a lower cost provider. They don't have to pay the high price just because they think that's the only place they can go. They should communicate with their provider. Bring your iPhone to your doctor appointment, pull up our website, and when your doctor says you need a chest x-ray, you can look up right there when you're sitting with your doctor that there's a cheaper place down the road than just going to the hospital x-ray department, and talk to them and make sure that's something that's okay with you and your doctor. So thank you for your time. That's a brief update on HealthCost and where we're going. Yes?
I noticed there's a sensitivity on the site to particular carriers. So you enter whether you're Anthem or Harvard Pilgrim or someone else, and that seems to change the pricing that is displayed. Now, as I understand, the public use database and the database, THIS database, does not allow the fields which show carrier to be known to the public. Okay. Yet somehow that's translating to price sensitivity on your site. How do you accomplish that without violating the private use of the data?
Well, we're using the data to calculate the rates, so we're not looking at any personal health information whatsoever. But I think what you're asking about is the public release of the data for general users, and that's controlled by the Department of Health and Human Services, and who's allowed to get what information. So that's sort of a separate question than what's available on HealthCost.
So when you get it for billing HealthCost, do you submit a data request to the CHIS that has to be approved by the panel, or are you just, because it's kind of an inside deal, you have access to the fields that the private sector can't get their hands on?
We're partners with the Department of Health and Human Service in the maintenance of the database.
Yeah, I think you're confusing sort of what HealthCost essentially is a report. It's not a release of the underlying raw data, which is what the HHS governs. And they govern it primarily from a patient privacy perspective. So that's really kind of what the HHS needs to be responsible for. The insurance department is essentially creating a report using HealthCost.
Okay, and then the other aspect of it, which I know we attempted to put legislation in, which kind of got defeated, was our interest. In fact, it got somewhat hijacked. Was our interest to have a national provider index available in the public use, which would have allowed private sector or similar sites to actually display doctors, as you have now started to do on New Hampshire HealthCost. It seems like there's not a really fair playing field here if you're not going to release that same stuff to the public sector.
Yeah, I'm not real comfortable speaking on behalf of DHHS on that front, but I think that the primary issue with releasing NPI is that you could end up with very small patient populations associated with a particular physician, and that suggests an opportunity for constructive identification. So if you know a hemophiliac went to a particular physician on a particular day, you knew how old the hemophiliac was, you know they was there for broken wrist, and that physician didn't see any other patients that day, you might have a good guess. That's sort of the idea. So DHHS, when they release any of those data, they're very sensitive to sort of small sample size. And I think that perhaps the issue is, well, if you release the provider identifier without any of those constraints, then it creates some of those problems. But again, I think that's something that DHHS should address specifically, not the insurance department.
Yeah, that's a really good point, Tyler. If you have any questions about that, I suggest you go to the Department of Health and Human Services. They control the release of the data, and I'm sure they can talk to you about what you can access and what you can't and so forth.